Okay, Sam, you ready?
Let's do it.
You see this, right?
Yes, sir.
Good, here we go. Endocrine glands differ from exocrine glands in that they do not.
Um, mm, Hold on. C?
Oh no, the answer is B. They do not have ducts. Remember, endocrine glands secrete their hormones directly into the blood.
Freak.
All right? Got it?
Yeah, I got it, man.
Good. Lindsay.
Hi.
Hey. Hormones can be all of the following, except
D.
carbohydrates, Ramsha,
Yes.
target organs respond to water-soluble hormones because of the presence of blank on the cell membrane surface.
Is it specific receptors?
It is. Very good. Ariana. Michael.
How's it going, Professor?
Good. Most of the amino acid-based hormones affect the target organs using, wow.
Are they intracellular receptors?
You know, let me see here. That's what I thought. So it's second messenger. It's the second messenger series, okay? That's a hard question. I wouldn't, that's the kind of the way it's worded is not really bizarre. It's bizarre. Jessica.
Hello.
Hello. Hormones that directly activate genes are called?
Is it A?
No. A needs a second messenger. Which one does not need a second messenger? You have two choices here. The two choices are water soluble and lipid soluble. Which one does not need a second messenger? Which one gets easily into the cell? That's the question.
Water.
Oh no, it's lipid. Lipid gets easily into the cell. Water soluble hormones have a hard time getting into the cell and they need second messengers. All right? Joseph. Thought you were there, Joseph. Isaiah.
Hi.
Hey. The islets of Langerhans are found on this endocrine organ.
Is it C?
It is C. You are correct. Let's stick with that one. Erica. Maddie is going to be late. Brianna. Spencer.
Hi.
Hey, tell me the two hormones that the pancreas secrete.
I'm blanking out.
No problem. No problem. Linnea. Melanie. Everyone's quiet today. Latricia. Dear Lord. Dwayne.
Yes.
The two hormones that the pancreas secrete.
I know I wrote it down. I can't remember.
Hannah.
I'm not sure.
Guys, your exam's on Tuesday. If you don't know where these hormones come from, you guys will be in trouble. Okay? The pancreas actually secretes 4 hormones, but I only want you to know 2.
Isn't one of them insulin?
Yes. One of them is insulin, and what does insulin do?
It lowers your blood sugar.
It lowers your blood sugar. What hormone raises your blood sugar?
Glucagon.
Glucagon.
Yes. So those are the 2 hormones I want you to know. I also want you to know, when we talk about hormones, what cells produce all the hormones. So we're talking about the pancreas. What cell in the pancreas produces insulin?
Beta cells.
Beta cells. What cell in the pancreas produces glucagon?
Alpha cells.
There you go. Okay. You got to know that. And remember, the anterior pituitary has 5 different cells that produces 7 different hormones. I'm going to ask you these questions. The majority of the exam is on the endocrine system. There are questions on the reproductive system, and there are questions on development and inheritance. But I'm going to say to you that 35 questions at least will be on the endocrine system. You have to know these hormones, what they do, and how they affect your body. Okay? Dennis.
Yeah.
In which region of the adrenal gland is aldosterone produced?
Is it B?
Yeah, the adrenal cortex. Now, let me tell you, if I ask this question, I'm going to ask you the actual region of the adrenal cortex. And the region of the adrenal cortex that produces aldosterone is the zona glomerulosa. So you better know those 3 areas of the adrenal cortex, okay? Carly.
Hello.
Hey, a gland atrophies after puberty. Which gland gets smaller?
Would it be the thymus?
Mm-hmm. It is. That's why your immune system, as you get older, atrophies too. So my immune system is not as good as your immune system. I'm more subject to getting cancer. I'm more subject to breaking bones because my thymus gland and all of my B cells and T cells are decreased because I'm older than you are. All right? Preet.
Hi.
Hey. Which endocrine gland? Oh, I would never ask this question. Never. Preet, hang on, don't answer it. I'll answer it for you. Which endocrine gland is tiny yellow brown in color and arranged in tiny branching cords? The answer is the parathyroid. I would never ask this question. So, Preet, here's the question I'm going to ask you. Where is oxytocin produced?
Hypothalamus.
Yes, the hypothalamus. The hypothalamus. That's where it's produced. Okay, good. Sarah,
Yes.
the vaccine will make you smarter. The epiphyseal plate is the target organ of this hormone.
Is it GH?
It is growth hormone. Sarah, did you take AP1?
Yeah.
Where's the epiphyseal plate?
I don't remember.
What structure is it on? Do you know?
I have no idea.
was your AP1 course virtual too?
Yeah, it was all Wiley, the Wiley Plus thing.
Oh dear God, that's why I hate Wiley Plus, because you don't learn anything. You don't learn anything. Okay, the epiphyseal plate is on every bone. Okay, it's the growth plate. It's what makes your bones get longer, and when you reach puberty, it becomes the epiphyseal line, and you can't grow anymore. Okay.
Okay.
See, I told you the vaccine made you smarter. Emma. Kennedy.
Hello.
Hey. What are the effects of parathyroid hormone?
I'm gonna go with D.
You are correct. All of the above. Mary Kate.
Hey, Professor.
Hello. This hormone is important in sodium regulation and therefore water balance.
Aldosterone.
Aldosterone. You are correct. Very good. Nicole. Gianna V. Anthony.
Hey, Professor.
Hey. For which hormone is the role in males not well understood? I think I talked about this a little bit when we talked about the male and having, well, I'm not going to give you the answer, so go ahead.
I'm guessing, but PRL. See?
Yeah, PRL. It's prolactin. Remember I told you that if a man comes into your doctor's office with milk coming out of his breast, it's not a breast problem, it's a pituitary problem. He has a tumor of the pituitary producing too much prolactin. Okay? All right. Melissa.
Oh, hi, Professor.
Hey. The target organ of thyrotropin releasing hormone is Melissa.
Oh, did my mic not turn on?
Yeah, I didn't hear anything.
Oh, I said D.
D is in thyroid gland.
Yeah.
You know, I would not ask this question because the minute you see the word thyroid, you think of thyroid. It actually comes from the hypothalamus. Okay, it comes from the hypothalamus and it stimulates the pituitary gland to release thyroid stimulating hormone to affect the thyroid gland. I want you to look again at the way it's worded. The target organ of thyrotropin releasing hormone. It makes the anterior pituitary secrete TSH. Melissa, you understand that?
Yeah.
Okay. Sam. Oh, I know you're there, Sam. You can't hide.
Yes, sir. I'm here. I'm here.
Okay. Which area of the brain regulates the endocrine system?
wow. I feel like I should know this.
Yes, you should.
Oh man, hold on.
I ain't going nowhere.
Yeah, don't stay right here. Is it the? Hold on. C.
Yeah, hypothalamus.
Want to say I know
Okay.
this one. Here we go.
Yeah, good. I knew you knew that. Lindsay,
I'm here.
much of the endocrine system regulates itself through a process called
Negative feedback.
correct. Ramsha,
Yeah.
don't be so happy. Hormones are secreted in response to all of the following stimuli except. This is a horrible question.
Yeah.
Well, look, let's go through it. Let's go through it, okay?
Mhm.
Are hormones secreted because of nervous stimuli?
Yeah.
Yes. Or hormones stimulated because of blood level stimuli?
Yeah.
Yeah. Or hormones stimulated because other hormones are stimulated?
No.
Oh, yes, wait. That's true.
Oh, okay.
That's
So
true.
yeah, all right.
So the answer is upregulation. All right?
Yeah.
Upregulation is a response not to secrete. It's just a response because the levels of hormones are low. Okay? Very different. Very different.
Is this a response to low levels of hormones?
Yeah.
Okay.
The cells, the target cells make more targets. That's
Okay.
called upregulation. Okay?
Yeah.
Okay. Let me see. Ariana Colon, you there or not? Probably, I don't think you are. Michael?
Yep. How you doing?
Good. Did I wake you up?
Nah, voice crack, man.
That's what happens when you reach puberty, Michael.
I know, right?
The anterior pituitary stimulates other endocrine organs by secreting a group of hormones called, we didn't really go over this, but
Yeah.
I wouldn't ask this. What'd you say?
Are they releasing factors or target hormones?
No, they're actually tropic hormones, but
Okay.
I'll give you another one. Here, take this one. An excess of hormones in the blood may cause the target organs to decrease the number of receptors for that hormone in a process called, Michael, don't answer this, Ramsha.
Yes.
Answer this. It's the opposite of what?
Down. I was gonna say down regulation.
There you go. Okay, now you understand it?
Yeah, I do.
All right, Michael, here we go again. Acromegaly is a result of hypersecretion of this hormone. You had a lecture on it last class.
Is it the parathormone?
No. Who gave the lecture on acromegaly? I actually think it was Nicole. It was Nicole. The answer is growth hormone. Growth hormone. All right?
Okay, gotcha.
Okay, no problem. Joseph?
I'm here now. My mic's working.
Okay, good. No problem. I knew you were there. Endemic goiter results from a lack of blank in the diet.
Iodine.
Correct. Isaiah.
What's good?
Hypoglycemia is a problem with which hormone? Isaiah, let me ask you the question a different way.
Okay.
Okay? Which hormone on this list lowers your blood sugar?
A.
Yeah, insulin.
Mm.
What's the word for low blood sugar? What does that mean? What word would you use for low blood sugar? Say the first word on the question.
Hypoglycemia.
Very good. All right, got it?
Yeah.
Okay. Erica, Maddie, you're not there. Spencer,
Yep.
Cushing's disease is caused by, you had a lecture on Cushing's disease.
It should be A, right?
No, that's Addison's disease.
Oh,
Addison's
wait. Okay.
disease, you're talking
The
about
wrong
the
one.
opposite, the opposite.
Yeah, it's hyper secretion of the adrenal glands.
Yes, you are correct. Good. Okay. Where are we here? Linnea, thought you were, oh, you are there. Good. Ooh, we didn't really talk greatly about this, but exophthalmos is a sign of hypersecretion of this hormone. Linnea, do you know what that word means?
No.
It means bulging of the eyes. It's an autoimmune, this is an autoimmune disease called Graves' disease. What is the cause of Graves' disease? It's a hypersecretion of this hormone, and one of the answers is correct.
Is it A?
No, it's actually thyroxine. Okay, but I'm going to keep on this because I'm going to ask Dwayne a question.
Yes.
Dwayne, tell me from this list of 4 hormones, the 2 that work against each other. One is the antagonist of the other.
B. Would it be B and C?
No. Hannah? Which 2 hormones work in the opposite way?
Is it? I don't know.
Dwayne,
Yes.
what does parathormone do? First of all, where's it come from?
Would it come from the thyroid?
No. Hannah, tell them where parathormone comes from.
I'm not really sure. Is the parathyroid?
Yes, parathyroid. Who said that?
Lindsay.
Lindsay. I was worried that I failed you people. Parathormone comes from the parathyroid gland. Okay? Dwayne?
Yeah.
Does it raise calcium or does it decrease calcium?
want to say it decreases it.
You better say the opposite.
It raises it.
It raises it. Dwayne, what does calcitonin do to calcium?
It decrease it.
So those are the two opposite hormones. They're both antagonists of each other. Parathormone raises calcium. Calcitonin decreases calcium. Everybody understand that?
Yeah.
Lindsay,
Yeah.
tell them where calcitonin comes from. What endocrine organ?
The thyroid.
Thank you. The thyroid. Okay? Know where these things come from. Not only know where they come from, tell me the cells that make these hormones. Calcitonin comes from the parafollicular cells of the thyroid gland to lower your calcium levels. Parathormone comes from the chief cells of the parathyroid hormone of the parathyroid gland to raise your calcium levels. Okay? What cells in the thyroid produce thyroxine? Dennis. Carly.
Hello.
Hey, did you hear the question?
Hello.
Yeah, can you hear me?
Yeah, I can hear you.
Did you hear the question?
Yes.
What cells of the thyroid gland produces T3 and T4?
I think it's D, thyroxine.
No. I'm talking about the cells. The cell. Not. Get away from this question. I'm talking about what cells, what actual cell in the thyroid gland produces thyroxine?
Would it be the follicular cells?
Yes, the follicular cells. Okay. All right. I also want you to know the pituitary cells too. You have a pituitary hormone here, growth hormone. What cells of the pituitary produce growth hormone? Anybody? You guys need to study for exam number 4. Okay, it's very simple. You know the cells, you know the hormones, and you know the actions of the hormones. The somatotrophic cells of the anterior pituitary secrete growth hormone. All right, Sarah.
Yes.
A person with endemic goiter suffers from.
Is it a hyper-functioning thyroid gland?
Which number? Which letter?
D.
No, endemic goiter means you have a hypo-functioning thyroid gland
Okay.
because it's not enough iodine to make thyroid
All
hormone.
right.
Okay?
Yep.
All right. Any questions on the endocrine system? It's the majority of your exam, guys. The majority of your exam. So let's go to the reproductive system. If I can get to it. Preet.
I'm here.
Be happy, Preet. Be happy. Which tube carries sperm from the scrotum to the abdominal pelvic cavity?
Is it C?
It is, otherwise known as the vas deferens. Okay, the ductus deferens. This is the one that's cut when you want to be sterilized and not have any more babies. All right? In the male. Sarah?
Me again?
Yeah, because you got the vaccine today. You're celebrating. You're celebrating, Sarah.
Oh God. Okay.
Which structure is not associated with the testes?
Is it B?
No, actually, they're all associated with the testes. We didn't go into it, but they're all associated. Okay, Emma? Kennedy?
Hello.
Hey. This gland is located inferior to the urinary bladder. And it also controls urine outflow in a man over the age of 60 because it enlarges.
B.
Correct. Mary Kate.
Hey, Professor.
Hey. Which portion of the penis contains the urethra?
B.
Correct. I like a quick answer. Very well done. Anthony.
Hey, Professor.
Which of the following glands produces a thick, clear mucus?
Is it A?
It is A. Melissa. Sam, you're up.
Yes, sir.
Oh, no. I'm not gonna, no. Okay, here. Where are sperm stored?
Oh, then the. Oh, where is sperm stored?
I asked that question, didn't I?
Yeah. Oh, it's B. The
It is. It's B, the epididymis. Correct.
epididymis. Yeah.
You are correct. Lindsay.
Hi.
Hey. Where do sperm acquire their motility?
C.
Correct. You are correct. Ramsha.
Yeah.
Spermatogenesis requires which of the following hormones?
Is it D?
Oh, yes. It's every one of those. Okay. Michael.
Hey.
Okay, Michael. This is your question. Here it comes. And if you don't get it right, you can't watch me tomorrow night on ESPN2, okay?
You can't stop me. Come on now.
Erection in the male is controlled by the blank nervous system, whereas ejaculation is controlled by the blank nervous system.
Shit. I want to watch you tomorrow. Hold on.
Arousal versus ejection. That's what we're talking about here. Arousal versus ejection?
Is it B?
Oh, you can't watch me tomorrow. What's the arousal system in your nervous system?
The arousal system?
Yeah, what's the action system in your nervous system? Is it sympathetic or parasympathetic? What makes you run away? Fight or flight, which one? Sympathetic or
Flight.
parasympathetic?
That'd be your flight, right? And then that'd be parasympathetic?
No, sympathetic. So here, the answer is parasympathetic and sympathetic. I'm going to ask you this question. I can almost guarantee you something of this question will be on exam number 4. Okay? I guarantee it. Guarantee it. All right? Joseph.
Yep.
Ooh, I would never ask this question. I would ask the opposite of this question. Okay? What is the inferior portion of the uterus called? Inferior. Forget about superior. What's the inferior portion of the uterus called? Where do doctors get pap smears from in a female?
Is it the cervix?
Yes. The answer is cervix, but the superior portion is the fundus. Okay, but I would never ask about the fundus. Okay, I would ask about the cervix. All right, Isaiah.
Hello.
Hello. What structure has fimbria? Fingers. Fingers. It has cilia in them. It makes the egg travel.
A.
Answer is C. Okay. The answer is C. Let's see. Spencer.
Yep.
Follicle cells are part of the, don't worry, but you won't know this. We didn't talk about it. Don't worry about it. Here's another one. In a nursing mother, the milk accumulates in the let me.
Is it the? Oh, sorry.
No, yeah. Let me, Spencer. Let's look at it in a different way. You know, everything is equal usually in the body. So, you know, ducts carry stuff, glands make stuff, and sinuses hold stuff. Okay? Look at your face. When you have a cold, you accumulate mucus in your sinuses, correct?
Yep.
So where would milk accumulate in the breast?
It would be D.
Yeah. All right?
Okay.
You got to look at it that way. That's the way you have to look at it. Okay? Melanie, you're not here, are you?
Oh, I'm here, Professor. Sorry.
Oh, you are here.
Yeah, I was just
That's all right. That's all right.
Earlier.
Yeah, not a problem. Don't worry. Don't worry. I would never ask this question. Do not answer it. The uterus is anchored to the anterior body wall by the round ligament. The most important ligament involved here is the broad ligament. That's the one that posteriorly holds the uterus, and that's the pain you get when you're pregnant and you're back from having a baby. All right, so answer this question. I will ask this question on exam number 4. Ovulation is stimulated by which hormone?
B.
Yes. LH, luteinizing hormone. Without the LH surge, you will not ovulate. Very important. Dwayne,
Yes.
fertilization occurs in the
It's either. I know it's either B or C.
You are correct. It's either B or C.
I want to say B.
You are correct. B. I'm going to ask this question on exam number 4. Guaranteed. Okay, guaranteed. Hannah. Hannah, you don't want to play, huh? Dennis.
Yes.
Immediately after ovulation, estrogen and progesterone are secreted by.
Is it C?
It is. It
I am
is C.
smart. I'm
Very,
very smart.
very good. Carly.
Hello.
Hey. During the part of a normal menstrual cycle, when the levels of progesterone and estrogen decrease, what will occur?
B, menstruation.
You are correct. You are correct. Let's go to Preet before I leave this.
Hi.
Hey, tell me which hormone is essential in the maintenance of the endometrium of the uterus so that the embryo can implant.
Is it estrogen?
It is progesterone. Progesterone. Okay? All right. Where are we? Sarah.
Yes.
Ooh, this is a hard question. I would never ask a question this hard. When in the uterine cycle are progesterone levels the highest? Don't answer it. The answer is secretory phase. Here's another question for you. Which of the following statements is true of both the male and female reproductive systems?
Is it B?
In the female, the urethra is not part of the reproductive system, only in the male.
Right. Is it A?
The testicles of the male are not in the abdominal pelvic cavity.
Okay. I don't know which one it is.
Go ahead.
C?
Correct.
Okay.
C. All right. All right. That vaccine helped a little bit, I think. You know I'm joking. Kennedy.
Hello.
Hey. The areola is an area found on the blank.
C.
What did you just say? You didn't say D, did you?
No, I said C.
Oh, I'm sorry. I apologize. I apologize. Wow. Very good. Sorry, I apologize.
You're good.
All right. Mary Kate.
How you doing, Professor?
I don't know, tell you the truth. I'm a little worried for you guys. So here we go. But no. All right, here we go. Which of the following has a very acidic pH?
C.
Ooh, no. Close though, close.
B.
Yes, B. All right, good. Anthony,
Hello.
hello. Oh, you might not know this word. You might not know. I would not ask this question, so don't answer it. I'll give you another question. Cryptorchidism means that the testicles fail to descend. Okay, they stay in the abdominal cavity. All right.
Is this testicular torsion?
No. Testicular torsion is when the spermatic cord twists and can't untwist.
That's like extremely painful, right?
Very painful.
And it could happen randomly.
And it can happen randomly, especially at your age.
Well, I'm
Can't
not
happen to me. I'm too old. But it can happen to you. Okay? But let me ask you a question. If your testicles fail to descend, what is the likelihood of you being able to produce children?
It's lower, right?
It's lower. Why is it lower? I'll ask it another way. Why are your testicles outside of your abdominal pelvic cavity? You think God was having a field day that day and forgot to put your testicles into your abdominal pelvic cavity, so he decided to put them in your scrotum?
It's for cooling purposes, though, right?
Thank you. Yes, because if the testicles were in your abdominal pelvic cavity, it's 3 degrees higher in temperature, and your sperm could not mature. That's the reason. Okay. Melissa. All right, Sam, this is yours.
Did you call me professor?
Oh, sorry. I'm sorry, Melissa. I apologize.
That's
You
okay.
ready? You ready?
Yeah.
Boom. Which of the following structures in the female are homologous to the scrotum?
Would it be B?
No, it's actually C, the labia majora.
Those were the two that I was kind of going back and forth between.
I understand. Well, it's the bigger lips is what homologous to the scrotum. Okay. All right. Majora means big, so big lips is what it means actually. All right. Let me stop recording.